Hello, I'm Dr. Laukkanen. Thanks for joining me as I talk about a radiation boost for breast cancer. So, standard radiation involves treatment of the whole breast. And a boost is when more radiation is given, but it's localized to the area where the surgery was done. And a boost is usually given in 4 or 5 sessions that follow after the whole breast treatment is finished. Here are a couple of examples. Here's a cross section in that area that is bounded by the red line is where extra radiation is being given. And here's another example, this one a little closer to the surface. So who's most likely to benefit from having an increased dose to the area where the surgery was carried out? Well, it turns out that younger people, and younger is typically 50 or less, or where, for a variety of reasons, the surgical margins were close and typically less than a couple of millimeters. And there are other situations where one looks at the nature of the cancer under the microscope, and typically it's a combination of factors, a higher grade, other features that might point to a greater aggressiveness and tendency to be uh, more in the area. And one would be the invasion of little tissue fluid or blood spaces that are immediately around where the cancer was. And what is the effect of having the boost? Well, as you might imagine, for people at potentially higher risk, the likelihood of the cancer coming back right in that area is decreased by the boost, and perhaps by 4 or 5%. And one example would be at 5 years that the freedom from a local recurrence might increase from, say, low 90s to the higher 90s, 92% to 97%, for example. But whenever radiation is given to the normal tissues, and when the radiation amount is increased, there can be an increased effect. So the key impact is the development of potentially more fibrous tissue around that boost treatment site. So the area might feel more firm, and with that, it may be a bit more likely to be tender or sensitive. And studies have shown that a few percent of people have that effect. And whether one develops that depends in part on where one is starting from, the location and overall size of that boost area in comparison with the whole breast. So thanks very much for your attention to this.